So will a patient do more damage if they hold off on having their knee replaced? I think the answer is technically yes. And if you take the pessimistic view, the day we're born is the day we start dying. And so I don't believe, though, that most patients, as they continue to wait, are going to wear out their joint to such a point where it's going to make my job harder or their recovery harder. Yes, there are cases where things progress very rapidly, but overall, you want to make sure that you need this surgery before you jump into it. Causing more damage is not really going to be the case. There are some considerations where I tell a patient, listen, we ought to start thinking about doing this. Ultimately, I let the patient make the decision. I say, when the bad days outnumber the good days, when this knee or this hip keeps you from doing what you want to do, what you need to do, or you pay for it after you do something, and when you've tried non-operative therapy and it has no longer worked, or you've decided I'm tired of doing this, that's when we start to broach the subject of having surgery. But there's a couple of considerations that you need to keep in mind of when you really need to push yourself. And so we know pre-operative motion predicts post-operative motion. Now what that means is if you bring me a knee that won't bend anymore at all, it's going to be tough for me to bend that knee all the way back and to give you that motion back. So certainly that's a consideration. My other considerations are not that you're wearing out the knee too much or you're wearing out the hip too much, but that you're keeping your heart and your lungs from being healthy by limiting your activity. And as you become decompensated because you don't want to do anything because of this hip or this knee, you should be talking yourself into something to get you back out there and to stay active. I know my role as a joint replacement surgeon is to get you a better quality of life, get you out of pain, but also to keep your heart and your lungs healthy so that you can stay with us longer. So I don't really buy into you're doing more damage and you're going to make my job harder. And while there's rare cases that can happen, for the most part, we just need to look at these other factors that should talk you into having surgery.